Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. And on these weekly mini episodes, we bring you bite-sized ideas for you to snack on.
Like breathing exercises, book reviews. Maybe we'll review some scientific research, or we'll share some wellness and fertility stories from our listeners.
So if you're looking for a tip or a trick related to your fertility and well-being, then you've come to the right place.
Let's dig in. Welcome back, everyone, for our next episode with Julie Bindeman. And I'm going to start this one the same way I did for the main episode with a trigger warning. So we're talking about another difficult topic today. This episode, we're going to talk more about her story specifically, and it is a story about terminating for medical reasons. And it's a very important story to tell, and we need to talk about these things and make it so other people aren't so isolated. But if you are not in a place where you feel like you can, you have the capacity to deal with that in your head or your heart, then please do skip this episode. Come back to it if you need to, but take care of yourself. And then, of course, we will be sharing resources both in the main episode show notes as well as this one. So you can look there if you want more information.
Well, welcome back. I know we didn't talk too much about your personal story in the full episode because we wanted to really keep it a little more on that professional side. But thank you for being able to come here and just kind of tell us more about your experiences. So wherever you want to start works for us.
Sure. So I'll give you the long, full, drawn-out version, if that is okay.
Perfectly fine.
Yeah.
I like to try to tell the story as completely as possible. It's really interesting because before my partner and I got married, we actually had a conversation about what would we do if we had a problem in pregnancy.
What made you think of having that conversation? I've never met anyone else that had talked about it before.
We had the conversation because his older sister has a disability. And so a lot of the people that she is friends with and that she hangs out with have varying different kinds of disabilities. So a lot of the people in her community happen to have Down syndrome. So that kind of was like the one that we sort of circled on, was like, what if we had a pregnancy where Down syndrome was present? And we talked about it and we're like, well, we know that we're going to be taking care of your sister, after your parents go. And, I don't know that we would want to bring in another person that's going to need lifelong care. And what might that mean for other children we have in terms of having to care for their sibling in that way? So we both decided that we would want to terminate the pregnancy. And then we kind of didn't think much more to it. I remember to our wedding day, and I think for lots of people on their wedding day, they just have like a plethora of random thoughts. And one of the random thoughts that like popped into my head and then popped on out was, I'm so happy I'm getting married. It means I won't need an abortion. Okay, so much mythology that we can unpack in that statement, but that's for another time. Again, didn't think anything more about it. And we decided to start trying to build our family. I will say in advance, like, we are freakish when it comes to this. So like, I know that fecundity rates tend to be about 20% on any given month for people. So like the idea of people can get pregnant, like a 1 in 5 chance on any given month. We have a different fecundity rate than that. So we tried our first month and I was talking to a friend of mine. She shared with me that she was pregnant. I'm like, oh, I should be getting my period now. I haven't gotten it, huh? I guess I'll test tomorrow. And I'm like, and because we're on the phone, I'll let you know what it said. Like, so naive. So that's what I did. And, she's already in her second trimester. And I'm like, as my dad used to like to say, fresh out of bed. And I pull out the pregnancy test and it's positive. So I call my friend and I'm like, oh my God, I'm pregnant.
So did you tell your friend before your partner?
No, I told him first, that to be fair.
Okay, good. I was like, wow, you really promised her. Yeah. Okay.
But she was like my next call. So we were, really excited. And in my mind, once you get a positive pregnancy test, you have a baby 9 months later. Like, that's just how it works. So I was really naive and I didn't think of anything. And I happened to have a pretty uneventful pregnancy. mean, for me, it was pretty eventful because I'd never been pregnant before. So it's like all these changes. And so 9 months later, almost to the day, he was born the day before his due date. I appreciate that from him. You know, I had a little boy. And so our journey of parenthood began. And when he was about 18 months old, I mean, he was an amazing sleeper and an amazing eater. And he talked by the time he was one. Like, he was hitting the milestones, not in a normal kind of way. So we're sitting there being like, clearly we have amazing genes and we are truly exceptional.
Yeah, clearly you're very good at this. Yeah, you definitely need to write a book.
Right? We create superhumans.
We must give more to the world. I mean, the egoism of it. So I get it, people. I get it. And so I remember saying to my partner, you know, it happened so quickly the first time. No way it will happen that quickly next time. You know, if we start trying now, I'll probably get pregnant within 6 months. And actually, that feels like better timing. And he's like, all right. And so we started trying, and I took a pregnancy test 2 weeks after I ovulated, and it was positive. And I'm like, no, thank you. This is not supposed to happen. I'm supposed to get pregnant in 5 more months. Like, this is not, nope, I don't like this. And I felt really ambivalent about it. And I noticed that, like, I wasn't getting really sick, whereas my first pregnancy, I had, I think, really normal morning sickness. And so I'm like, what is going on here? And I go to the doctor because there was a little spotting, and I had an ultrasound, and we saw the electrical pulses that will potentially be a heart. I also am that way too when it comes to heartbeats. My clients make fun of me. They're like, I know it's not a heartbeat. I'm like, no, it's not. Not yet, at least. So, you know, we saw that, and I was told to come back 2 weeks later. So I came back 2 weeks, and I was still measuring at 6 weeks. And I'm like, well, wait a second, I should be measuring at 8 weeks. Why am I measuring at 6 weeks? And because I had a tech in there, I had to put together, oh, I miscarried. And she's like, well, I can't tell you anything. And I'm like, awesome.
That's so hard. I know.
Not an idiot, but okay. So then the doctor comes in and confirms, yes, I miscarried. You know, I had miscarried 2 weeks ago. And so I'm sort of sitting here and I'm not feeling any different, except like I'm not feeling sick at all. And I was like, maybe I don't have to feel sick this time. That would be great. And offered a DNC, which she didn't have openings for another 10 days. And I remember being like, all right, because I didn't want to use the 2-pill combo. I was concerned about how that might feel and doing that in front of my son and like not being available. And so I'm like, cool, we'll just go for surgery. So, I remember like part of my thinking was like, I have a dead baby inside of me and I don't want this dead baby inside of me. Like, I just want it out. I just want to start again.
That's very common.
Yeah.
Mm-hmm.
So I also remember as I'm lying on the gurney, and, you know, starting to go under sedation, I look at my OB and I went, I think I'm going to have to focus on this as an area of clinical specialty. So, because that's a normal thought to have before you go under. So I have the DNC, no complications. That was great. We tried again. And I was so excited because I thought I had a period. And I remember saying to my partner, this is great. We didn't get pregnant. Like, we get another month to try. And he was so excited. And I was so excited. I'm like, okay, awesome.
That's so the opposite for most of our patients where,
right?
Yeah.
So
I'm excited to not work.
So I also remember after the miscarriage, I really wanted to be pregnant again. I like whatever ambivalence I had during the miscarriage, I was now firmly on, yes, I want another baby. And so that's another thing that happens a lot to people too, is that, you know, and it doesn't have to happen, but sometimes that ambivalence and the loss is like, oh, no, I actually do want this. I went about my business, and about 2 weeks later, I'm at my office doing my thing, and I notice I start bleeding. And so I'm like, this is weird. I shouldn't have a period 2 weeks later, because in case you haven't figured out, I'm a little type A. So I'm tracking and I'm doing all the things. And my monitor had said that I wasn't, you know, I'm supposed to get near ovulation. I should not be menstruating at this point. So I call my doctor and they're like, go take a pregnancy test. And I'm like, oh, you silly people, I had a period. Yes, it was a little light, but I had it. It was 2 weeks ago. We're good to go. So I do as they say. And I come back to my office and I take the pregnancy test, and oh my God, it's positive. And I did not expect that because I am actively bleeding here and I have a positive pregnancy test. So of course, my mind goes to the one place it could, which is certainly I'm miscarrying again. And this was what I was thinking was a really different experience than last time. And I'm really upset about this. And so I call my doctor back and they're like, we can see you tomorrow morning. And I'm like, great. And I like somehow get through the afternoon of patients.
I say you're still at work. I think people forget about how often bad news happens at work and you just have to like focus on.
There's never a convenient time for bad news, but it seems to like to happen right when even more difficult to deal with.
I mean, the amount of women that have had to do their job while miscarrying is pretty crazy. If you really start asking people about it, like, well, I just kind of put on pads and wouldn't change it every hour. And it's we don't talk enough about these things in so many different ways.
And to be a therapist where my whole job is to focus on what somebody else is saying, where all I can do is sit here and be like, my world is ending. My world is ending. Like, how am I able to listen to somebody else when like my world is ending? So that was an interesting experience too. I cancel my morning clients the next day. I go to the doctor and I'm given blood work and I'm like, well, so this is really not useful because I'm going to need a second beta in order to, and I knew enough to know like, this is not going to help me at all. And so I asked, like, I really want an ultrasound because I need to know what's happening right now. And so they get me in a radiology office and I go and I get an ultrasound. And of course, they can't tell me anything, but they send the image down to my doctor. And I am then sitting there waiting as they try to squeeze me in to tell me what the ultrasound said. So like, I am waiting and waiting and waiting. I am not the most patient person. I am freaking out. And so when I go back to speak to my doctor, she's like, so here's what we are seeing. I see a 5-week about pregnancy, and it seems to be doing fine. And I see a subchorionic hematoma. And, right now, the SCH is on one side, the pregnancy is on the other, but I want you to be on pelvic rest. I'm like, what's that? So I learned a whole thing about what pelvic rest was. And I was able to work because I sit for work. So that was okay. And I'm like, and I was come back next week. So I came back the next week. The bleeding is still continuing. And we checked the subchorionic hematoma. It's gotten bigger, but also we now have electronical impulses where, the heart might develop one day. And so the pregnancy is progressing. I was put on bed rest at this point and I couldn't work. And this is before we were so familiar with Zoom. And I go back again. And at this point, the subchorionic hematoma is gone, just as they had hoped it would. And the pregnancy continues to progress. But I'm only 8 weeks along and or 9 weeks. And I'm like, well, I could still miscarry at any moment. So I'm not feeling very safe or comfortable in the pregnancy, even though all the information that we're getting is good. And by this time, I am now vomiting nonstop. And so, we're continuing to progress. I get through my nuchal fold. That looks great. I get through my week 16 blood work to the quad screen. That looks great. Awesome. We are now at the Friday before Thanksgiving. And this, just to put some context in it, happened to be 6 months after this doctor in Kansas was killed. His name was George Tiller. And I remember seeing that on the news. And I remember thinking to myself, well, I don't really understand why someone would have an abortion in their second or third trimester, but it's not my call to make for someone else. And I thought it was horrible that he was killed for that. But other than that, I'm like, okay. And so we get to the 20-week scan and we go to my doctor's office and they're like, oh, you didn't get the message? We can't scan you here because your insurance won't pay for it. You need to go to a radiology center. I'm like, and my partner had taken the day off of work and this was a big thing. So, okay, we go to a radiology center. They were able to get us in. Great. We meet with a tech. She is so super chatty and friendly. And she's like, do you want to know what you're having? And my partner and I look at each other. We're like, isn't that the only reason to come to this scan is to find out what you're having? This is before the NIPS. So before we could have early ideas of what we were having. And so she's like, all right, well, you're having a boy. And I remember a tear coming down because everyone was like, oh, you're so sick, you must be having a girl. Like, you have all the symptoms, you must be having a girl. And I was really sad to learn that I was having another boy. And I regrouped and I'm like, all right, well, my son's going to be an excellent brother. And now I get to do hand-me-downs and that's fine. And okay, we can think about it. So I remember asking the tech, oh, does the radiologist want to come in and talk to us? And she's like, no, just go back to your doctor's office. And because I was outsourced in that way, I didn't think anything of it. So we're like, okay. So on the drive back to our doctor's office, we're talking about names and what name might we want to give. And like, we're really starting to like invest. Not that we hadn't before, but like really starting to invest. Weeks ago, I'd started telling my clients I was pregnant and I would be due in early April. And, I would have a plan for them and just, wanted people to understand what was going on. So we go back to the doctor's office. We get ushered back into one of the studies. And again, my partner and I are just talking animatedly to one another, really excited about this. And the doctor comes in and she looks at us and she's like, I'm so sorry. And my response to her was, yeah, it's another boy, but that means we'll have to go for a third so we could try for our girl then. And I think she must have thought I had two heads or something, because that was not the answer she expected to hear from me. And it dawned on her that we didn't know anything. And she said to us,
oh my goodness,
did they tell you anything? And we're like, no, just that it's a boy. And she's like, oh, so it seems like there are some problems with your baby's brain. And my husband was able to absorb that in a way that I wasn't at that time. And I remember sitting there going, well, okay, well, what about brain plasticity and can things rewire and whatever might not be there? Like, I am going into psychologist mode. I'm going into the way of like what I know about the brain. And she's like, I don't have the answer for you, but I set up this afternoon for you to go to a maternal fetal medicine clinic, and you'll go there and they'll get more imaging and, they can tell you more. Ask these questions there. We went to the doctor and she's doing a scan and she starts talking about things like ventricular megaly. And then she starts talking about hydrocephalus. And we knew what hydrocephalus was because that was something that my sister-in-law experienced. And hydrocephalus is just a fancy term that literally means water on the brain. So when you have a developing fetal brain and you have fluid in that brain, it means that there's no space for all the other parts of the brain to grow, because the brain doesn't start out whole, it grows over time. When we're looking at the image, she's like, yeah, and ventricular megaly means that the brain ventricles that drain the cerebral spinal fluid into the spine were enlarged. And if they're enlarged, it means that they're not draining properly, which is why there's additional fluid on the brain. So I'm learning all sorts of big fancy words I had never learned before. And we meet with a genetic counselor and we start talking about my husband's family history, where hydrocephalus, we have a couple of people that have hydrocephalus. And she's like, well, there's only one gene that we know of that causes hydrocephalus. It's X-linked. We can look for it, but most likely that's not what this is. And we want you to go for an MRI and another ultrasound. We want to send you down to Children's National. So we plan that for the next week, and we go with my husband and I. We asked my mother-in-law to come with us because she raised a child with hydrocephalus. We figured she had some good questions she could ask. And we asked my dad to come with us because he had connections at Children that, like, if he needed to grease wheels, we figured he could do that. So we were sort of strategic in who we had come with us. And we're lucky, like, our insurance paid for this.
I was going to say, like, even with all these resources, it's still so much.
None of this came from our pocket. We were pretty lucky in that. So we met with a team there. They did an MRI and they did a level 3 ultrasound, and we met with their genetic counselor, and we met with the pediatric neurosurgeon and all of these people. And we're sitting around, we're sort of getting other pieces of the puzzle. And one of the things that we learned is in the 4 days since our first scan, The ventricles have gotten bigger. At this point, they were measuring 2.2 centimeters. And just for context, because I imagine none of us are brain experts out there, the top end of normal for brain ventricles are 1 centimeter. So typically they measure about half a centimeter to a centimeter. That's sort of the normal range. We are so outside of this normal range now. The radiologists, they're all talking to us. They're like, well, we can see parts of the cerebellum, but that's it. So we have basically a primitive brain stem. And they're like, oh, we noticed the baby's swallowing. That's good. And I'm like, all right, well, is he going to be able to feed himself? And they're like, oh, no, he won't be able to feed himself, but he'll be able to swallow if you give him food. So maybe that means he won't need a feeding tube. And I'm like, this sounds terrible, because we didn't know if he could even chew it. So there's all these different kinds of questions. And we're like, well, what's the prognosis here? And they're like, well, he could die in utero. He could die shortly after birth. We would have to do a C-section, and then he would have emergency surgery to put a shunt in. And that shunt is just going to stop whatever additional damage. It's not going to be able to correct anything. Or he could live until his 40s. And if he does live, there are different kinds of chairs that he can sit in, because we don't expect him to walk. We don't expect him to talk. We don't expect him to be able to really do anything. And I remember looking at my husband, and I'm just mortified and terrified. And I'm like, that's not much of a life. And that previous weekend, we had talked about what our parenting boundaries were. So we didn't know what they were going to tell us at Children's. And we talked about, okay, what are our markers? Like, what is it we can handle? And so we talked about quality of life. That became really, really big for us, is what is the quality of life of this person? Because we had to think about our other son, and what would his quality of life be if we had a medically fragile child or a special needs child? What would that mean to everybody? What would it mean to me? Like, I had just started my career as a psychologist. Like, would I anticipated I'd probably have to stop and stay home? And, what would all of this mean? And we decided that our boundary was, if there wasn't going to be much quality of life, then we would terminate. And so when we're hearing all of this, it was really clear to us that this was not a quality of life that seemed fair. Wouldn't be fair to our older child. It wouldn't be fair to this child. It wouldn't be fair to anybody. And so we made the decision pretty uniformly that we were going to terminate.
Now, did you bring that up, or did they offer that as an option when they were talking about the different scenarios?
They offered it as an option. So both the first MFM and Children's offered it as an option. Now, because Dr. Tiller had been killed, they're like, we don't really know where we can send you, because we would normally tell you to go to Hopkins or University of Maryland, but they're not doing procedures anymore. I'm like, what do you mean they're not doing procedures anymore? And they're like, yeah, they closed shop. And I didn't realize until later it was because of Dr. Tiller's murder. So it really did have a chilling effect. And I experienced the result of that chilling effect, because in my state, I'm totally within the window of being able to have an abortion. Even if I was further along in pregnancy, my state would still allow me to have an abortion, because there are exceptions for impairments. There are exceptions for health of the mother, mental health of the mother, and fetal anomalies. So I live in a place where already it was pretty wonderful, except that there was no provider. I was told that I could go to New Jersey, which is the closest state to where I was, that would terminate after 20 weeks and do a surgical procedure. Or I could stay home and we could see if my OBGYN would deliver me at my hospital. And so we decided that we would keep for the comforts of home, and I would get delivered there. My OB was amazing, and I feel really fortunate for that, but other parts of the experience less so. I was in labor for about 18 hours, finally gave birth. I chose not to spend time with my baby. We were given that option. It was not something my husband and I felt that we could do. It's not something I really regret, but I also know how impactful it can be to have that time with babies. So I just sort of want to acknowledge that piece. And we decided not to name him. And part of what was really useful for that is my husband is like, look, whatever name we have, like these names are with purpose and they're really important. And we want to give a name to a baby that is ensouled. And this baby was not ensouled. And so, it's our job to create a body so that the soul can go into the body, and that will be the baby that we name. So it was like, wow, that is so spiritual and deep for someone who tends not to be very spiritual. So I'm like, I can get on board with that. And before we decided to terminate, I reached out to our rabbi and I asked her to come over, and she had done a ritual with us after the miscarriage. And I'm telling her about this situation. And I'm like, so am I going to hell if I terminate? And she's like, first of all, you're Jewish, so no to hell, because that's not a thing for us. Okay, well, that's good. And she's like, and actually in Judaism, we believe that the life of the mother takes precedent over the life of a fetus at any point until the baby can breathe. And once it can breathe on its own independently, then it's seen as another life. So that was also reassuring. And we did a ritual after that loss as well. And so we had some testing done. It wasn't the genetic issue that it could have been. And we were basically told this was a 1 in a million thing, that it happens sometimes. We don't have any explanation for it, but go ahead, get pregnant, and, we'll monitor you and it will be fine. And so it took me about 4 months to get my period back. It was tracking again. I ovulated. 2 weeks later, I had a positive pregnancy test, and I'm terrified. And I'm feeling sick again, because as soon as I delivered the last time, like the nausea went away. So I'm feeling so sick again, and I'm getting monitored every other week, and it's terrifying. I get a scan, and then into the room walks the genetic counselor. And I look at her and I go, don't take this the wrong way, but it can't be good news if you're coming in. And I'm like, it's not that I'm not happy to see you, but also you have no place in the show right now. So there must be a reason you're here. And she's like, well, we're seeing some things. I know you weren't going to have the MRI. We really want you to have the MRI. And then the doctor comes in. She's like, the ventricles are measuring at about 1.2 centimeters. It's that top end of normal. We want you to have an MRI. We know, I know that wasn't going to be your plan, but I think it's important, but cautiously optimistic. And I'm like, okay. So we scheduled the MRI for the next week, because that was the soonest. 18 weeks was the soonest that they could do it and have something definitive come from it, that there's enough differentiation in the brain to be able to make something of the scan.
And just to side note, how much more you know about neurology at this point, like thinking about doing this for the second time compared to the first.
So much more. And I keep on learning, right? And I'm like, not like I want to learn this way, but so
right.
we go in again. And of course, because I'm at a children's hospital, they didn't yet have adult MRI machines. So I'm in this tiny little children's MRI machine, pregnant.
Oh my goodness.
So that's a thing. So I'm now 18 weeks pregnant. I go in for the MRI. I'm talking to the same radiologist. I get the level 3 ultrasound, and she's like, hey, so we're seeing ventricular megaly again. We're seeing hydrocephalus. And we're seeing partial agenesis of the corpus callosum. And I'm like, oh, so this is different than last time. She's like, nope, that happened last time too. And I'm like, well, what even is it? And she's like, it means that the corpus callosum, which is think of it as like the super highway that connects your left and right hemispheres. Like, think of it as being under construction and not complete. And so some of the roads are there, but other of the roads just kind of end, and they don't cross over the bridge. Like, there's no bridges there. So I'm like, well, again, brain plasticity, can those things grow? And she's like, no. She's like, what's interesting, what the research tends to show is that people who have a full agenesis are more likely to have some kind of normal outcomes than people with partial agenesis. Because if you think about it, like if you're driving down the road and like the road suddenly ends, right? You can't get over it in any way. But if you don't know the road is there, you can make your own path. And so that's sort of the differentiation. So again, learning a lot, so interesting, not how I want to learn it. And so we're told, okay, now because I'm inside of 20 weeks, I can either carry to term and sort of see what happens, or I can terminate and I can have a dilation and evacuation, a D&E. And I can do that in DC because there are doctors that will do it. DC's law was 20 weeks at the time. So, and still is, in fact. So we talked about it. And what was super hard about this one is I had learned that the baby's assigned sex was female. And so it was the girl I had been dreaming about. There was this part of me that's like, but I don't want to lose my possibility of my only girl. And my husband's like, hold on a second. The only reason it's not as bad as last time is because we're looking at this 3 weeks earlier. So,
yeah.
you know, this is not going to be different. And because we chose to do a D&E, we went to a hospital in DC. It was like night and day in terms of how we were treated. We had such compassion. We had prescriptions called in the night before to begin the dilation of my cervix. And I went down to the hospital the next day with my husband. The doctor who saw me met with me, like, he stayed in his office till 7:30 at night so he could squeeze me in to meet with me, and then scheduled me the next day. Like, he was amazing, and I feel like he is a superhero. We went, and I'm starting to be in labor because my cervix is dilating. They said to my husband, you stay here, you'll get her checked in. And they put me in a wheelchair and they had me go upstairs so I could get pain relief. And that was amazing. Like, they were really focused on how do you care for me? And this was a teaching hospital, so there were residents there. And it got time for me to get put under anesthesia. And I remember this time as I'm being wheeled off into the operating room, I say to the residents, you all need to focus on what's happening. This is so important for you to learn. Not many people know how to do a dilation and evacuation. You need to pay attention and learn this. Your patients will thank you. Like, I sound like a crazy
advocating
person,
before anesthesia.
right?
Yeah.
Apparently it's like what I do.
It's just in your brain.
It is,
It's just right there. Yeah.
So I have the surgical termination. We did some genetic testing as well. And, you know, again, nothing. We did a microarray. We found nothing. We didn't expect to find anything, but we still found nothing. And we're now talking to the team at Children's and we're like, hey guys, what gives? Because you told me 1 in a million. This happened twice in a row. That's not 1 in a million. And even 1 in 500,000, I don't accept that as what my odds are, because this is not supposed to happen 2 times, particularly twice in a row. And so they're like, yeah, well, we think it might be genetic. And so we start pursuing, okay, is this a dominant gene? Because there is this hydrocephalus experiences in my husband's side of the family. So they do brain MRIs of my husband and his mother and his sister, and they compare them to the 2 fetal MRIs. And they are not the same, which was reassuring because it meant, yay, not a dominant gene. So they're like, our best guess is that this is some kind of recessive gene combination that both of you have. We don't know what the gene is, because like already at this point in time, I'm like, we're going to find the gene and I'm going to do IVF. And if I need to get pregnant and have a surrogate pregnant, and we'll see what happens at 20 weeks, like, so be it. Like, I am having so many kinds of fantasies, crazy kinds of thoughts that now that I'm in the field, I'm like, no one would have let me do that. Like, that is not what would have been okay. And it shouldn't have been okay. Like, and it was just interesting to just sort of see where my brain went. And I recognized, like, I was super privileged that I could even think in that kind of way.
And going all this stuff, you're also still being a mom to your son.
Yeah.
You know, like, how are you coping with that and still being there for him emotionally? I mean, did he know that you were pregnant both of these times? And
yeah, he did. We had told him I was showing. He wasn't able to like jump on my belly or anything. It was both the best and the worst thing for me. It was the best because he was a distraction and I had to focus on him, and he was so cute and creative. And, you know, he's 2.5 at this point in time, and, you know, just a great age. And because he was such a great age, it was so hard to see what we couldn't give him. Like, we couldn't give him a sibling. We couldn't enjoy this again. All of my friends that were in my mom's group from him were all having their seconds. Some were even having thirds. That was the other piece, the social piece, where I just felt so behind, like almost like, just you can't catch up. And so that was really hard too. I mean, at one point in time after I'm healing from this loss, because now I've had 3 pregnancies and 3 losses. And so I'm trying to heal from it. And I'm in such a dark place. And I'm like, I just want to go to sleep and never wake up. And I was blogging about it. And one of my really good friends read the blog and she called me and she's like, I'm worried about you. Are you going to hurt yourself? I'm like, no, I'm not going to hurt myself, but I can't describe what it's like to live with this pain every day. And there's nothing I can do to escape it. I just don't want to feel the pain because it's just too much. It was causing issues in my marriage because my husband's like, okay, we'll try again and it will be fine. And I'm like, you said that about the last one and it wasn't fine. And I was just angry and I was upset that he wasn't as upset as me, but we've talked since, like, he processed it so differently than I did. I'm afraid that if I don't try now, I'll stop. And I know I really want another kid. And I'm so afraid, but I also want another kid. Y'all know the drill. 2 weeks after I ovulated, I had a positive pregnancy test. And I'm now terrified. I am like paralyzed with fear. And so I am trying to discern anything because, of course, in early pregnancy, you don't know anything. So it was like this roller coaster. I would be a mess. I'd go to my scan. I'd be so anxious. I'd have my scan. I'd feel relief for like 5 minutes. And then I was certain that I miscarried somehow after that. And just rinse, repeat every 2 weeks because I'm getting scanned.
I actually prepare patients for that too. I'm like, you'll feel better probably for the rest of today, maybe.
Right. If you're lucky.
Tomorrow it's going to start over.
Yeah.
Yeah.
Yeah. And it was such a short turnaround of that. Like I just couldn't get relief. And so I know this is a long snack. Sorry for everyone. But, just this was sort of like the rinse repeat. And I wasn't feeling nauseous. So with my miscarriage, I didn't feel nauseous. So of course I'm convinced I'm going to miscarry. I'm convinced every time that I'm not going to see the electrocardiac kind of pulses there, but they're still there and they keep on being there. So we get to 12 weeks and I'm like, okay, I still don't feel better. And actually I feel like the interim time between 12 weeks and whenever you feel the baby is pregnancy purgatory because you start to feel better. And if you're trying to read like symptom tea leaves, you don't have many symptom tea leaves to read and you don't have that feeling the baby. So like you're in this purgatory of like, is this still working? Like, is something happening? That was terrible. And I knew that I had to wait till 18 weeks before I got my normal MRI, which is what I apparently do in pregnancy. So we went down to Children's. I know. Went down to Children's. I'm back in the child size MRI machine and then getting the level 3 ultrasound afterward. And the radiologist peeks in as I'm getting the ultrasound and she goes, you all must be a mess right now. And I'm like, pretty much. Yep.
Yeah. Well, I'm so glad that she acknowledged that.
Yeah. And she's like, I'm going to sit down with you. I just wanted you to know that everything looks amazing. And I went, I'm sorry, what? Like, what do you think? Like, the brain is great. Everything's there that needs to be there. I'm like, are you sure? And she's like, yeah. And I'm like, okay. The other thing I want to make sure of is I've been told that, the assigned sex was going to be female. Is that the case? And she's like, oh yeah, no, that's the case. And I'm like, you sure? She's like, yep. So we went in to talk with her and she pulls up the image of the baby and it's this really differentiated looking brain. Like, again, I'm not a radiologist. I kind of play one on TV at this point. And what a brain is supposed to look like is like a lot of like gray and white and like lots of sort of different shades that are there and a little bit of black because black means fluid. And I said, okay, this is great, but can you also put up the other ones too? Because I need to see for myself. And she did. And it was so clear. And I remember looking at her and I'm like, I'm not a radiologist and I can see the difference. This one has lots of black, very little gray, whereas my child had lots of gray, very little black, except the places it needed to be. She's like, yeah, everything looks great. And I couldn't, like, my husband's like, awesome. Now you're going to relax. You're not going to be psycho anymore. It's great. Except in my head, I'm like,
If only.
oh no, I'm going to have a loss now in the third trimester because, that's going to be God punishing me in some way because, I'll need to experience that. My husband's like, you're so nuts. I don't understand. And it's just the fear, like this perpetual fear. I couldn't relax. And so I had decided I needed to look forward to something. So I decided that I was going to throw what I call an elephant party. What that is elephants gestate for 22 months, which I'm like, how? But okay. When it comes sort of all said and done with how long I had been pregnant, I felt like an elephant. I think it was actually only like 18 or 19 months, but still close enough. So I threw what I called an elephant party. And it was basically a thank you to everyone who had been supporting me for basically the last 3 years. And so it was this lovely celebration. And as a thank you, I gave everyone, my mom had found these compostable kinds of hearts that had forget-me-not seeds embedded in them. So you just plant them outside and they grow into forget-me-nots. And I loved the symbolism of that, of like, okay, we're not going to forget the babies. And so that was great. Fabulous birth. And she weighed 5 pounds, but apparently I just make small babies. So that was not something that was factored into it. So she's fine. Everything's fine. We go home and she's about 14 months old. And I look to my husband and I'm like, we had talked about 3. Should we try for a third? And he's like, are you going to be insane? Because if you're insane, we're not going to do it. Like I can't handle all the anxiety again. And I said, no, you're absolutely right. And he's like, and I lost you. I'm just getting you back. I lost you. I can't do that again.
Did you deal with any like postpartum depression with that after that?
Not with my daughter. No, like I did not. I relaxed as soon as she was born because like in my mind, my job was to bring her earthside. And once I could, we're good to go. I didn't feel concerns about like, would she be okay? So it was fine. And so she came, she was fine. She's now 14 months at this point, and I'm like, we should have another. And I'm like, so here's the thing. We have a 1 in 4 chance of miscarriage. We have a 1 in 4 chance of whatever this brain anomaly thing is, this recessive gene thing that we carry, or we're going to have a baby. And any of those circumstances, I think at this point, I can be fine with. I love the 2 children we have. I can feel like it's okay, but I feel like there's a part of me that feels like there's one more in our story. And, I want to try. And so the deal we had was if we terminated, that was it. If we had the baby, that was it. And if we miscarried, we could try again. So we were both on board with it. And so I got pregnant again. First month we tried. I told you my fecundity rate is insane. And I was really calm about it. I felt fine in the pregnancy. And it was really funny because I had told a friend of mine, I'm like, hey, I'm pregnant. And she's my yoga teacher, which is why I told her. And she's like, okay. She's like, well, have you set up your doctor's appointment? I'm like, no, I'm good. She's like, but Julie, you've got to go to the doctor. I'm like, but do I? Like, I'm okay. I don't we can wait a while. I just didn't want to start that like cycle of having to be at the doctor all the time and all the anxiety about the scans. So I waited until I was like 8 or 9 weeks before I went. We're doing all the things and it's great. And I remember the first time I go in for a scan and she's like, all right, so I want to see you back in 2 weeks. And I'm like, how about a month? And she's like, let's compromise at 3. I'm like, fine. I'm like, I just don't want to go back on that carousel. Like it was just too much.
Yeah.
And I don't feel like I need it. So I remember going in at like 14 weeks and she's like, everything's looking good. Or I guess it was 16 weeks. So she's like, I think it's great. You'll go in for your MRI because that's just what you do. But I don't expect it to come back as anything bad. So I went in at 18 weeks for my MRI. It was like such a different experience. My husband and I were all chatty and like excited about it. And we're like seeing these other people in the room who like have gotten these poor prenatal diagnoses and like, the world is blowing up. Like I remember talking to someone in the waiting room and, she's trying to sort of figure out like what prognosis might mean. And I'm like, look, you're in really good hands. I like gave her my card. I'm like, if you want to reach out, feel free. And we go in and we have the MRI, we have the ultrasound. I'm talking to the tech and I'm like, all right, I don't want to know sex because that's going to be the one surprise in this pregnancy. Nothing else is a surprise. I don't want to know sex. And she's like, oh, okay. And we're chatting and she says like, oh, it's so interesting. You know, boys' ventricles measure at this thing and girls measure at this. And I knew what the ventricle measurement was. And I was like, oh. So my husband already knew sex because he wanted to know. And I knew he wouldn't tell me. And so we go home and I'm like, so that was a nice slip that the radiologist made. And he goes, oh, you caught that? And I'm like, yeah.
You're like, yeah, I know a lot about ventricles now.
I'm a neurologist and a radiologist. And
well, I said to him, actually, it wasn't any of that. It was like, you do know that I listen professionally, right? Like
that's true too.
That is my job, is to listen.
I pick up on things.
He's like, so what do you think it is? And I'm like, I know it's a boy. And he's like, do you really want me to confirm or deny? And I'm like, just yes, because now we can plan a bris if we need one. And he's like, all right. He's like, well, we need to plan a bris. And I'm like, all right, that's fine. Like at this point, it doesn't matter. So we get to 38 weeks and now like we talk about maternal health here. And I remember this time I was like, I want a doula. I want this to be, you know, no interventions. Like I'm going to do all the things that I didn't get to do because this is the last baby I am having. So we get to like 38 weeks. My doula's out of town. The backup's on call. And I'm like, I don't feel good. And again, like my ankles are the size of my neck, like really abnormal kinds of things. And we go to a movie and I have a headache and I'm like, hey, honey, would you get me Tylenol? So he gets me Tylenol. It does nothing. It's extra strength Tylenol. I take 2, it does nothing. And normally that's enough to knock out a headache. Nothing. So I go home and I'm like, all right, I'll go to sleep in the basement. It's cold, it's dark, like maybe I'll feel okay. Nope, I'm feeling terrible. I wait till it's like 7 a.m. to call the doula and I'm like, hey, I don't think there's something that's not right. I'm concerned. She's like, all right, let me come over. And I'm contracting too. And I'm like, all the fun things. So she comes over and she's also a nurse. So she brings over her blood pressure cuff and, you know, she's actually taking my blood pressure and it's like 160 over 100, which is so far out of what my norm is. And she's like, yeah, I don't love this, but let's sort of sit in the dark and let me massage your feet and we'll put essential oils on and like, we'll just be really calm and I'll check in an hour. And I'm like, okay. And we're having a lovely conversation and the headache is still there, but like, I'm feeling really calm. And she takes my blood pressure again and it's the same. And she's like, so I think you need to go to the hospital now. And I'm like, oh, okay. So I go to the hospital and the doctor that's there is like, you're fine. Because of course at the hospital, my blood pressure is like 150 over 90, which is still not good. But like, they're like, just go home. And I'm like, but I've had a headache now for like 48 hours. And that doesn't feel okay to me. She's like, it's fine. It's fine. And I'm like, I don't know how fine. So my husband's finally like, well, can we get her something for the headache?
Ruby and I don't think it's fine, by the way. We don't like your story.
We have red flags everywhere right now.
You need your preeclampsia lab panel and your urine dip and all that stuff.
I'm like, you need to be on magnesium. Yeah. Like, I'm like so anxious.
Yeah.
And the nurse who saw me is like, why are you even here? And I'm like, what? Because my blood pressure is through the roof. Again, I'm swollen up the wazoo. We go to eat. I'm like, I call the doctor the next day. I had an appointment anyway. And I call the MFM and she's like, so you're going to come in and you're going to sit for a while because I will squeeze you in when I can. But I just want you to know you're going to sit for a while. I'm like, does this mean I have to cancel my patient? She's like, yes, it means you have to cancel your patient. You're going to be hanging out in my office. I'm like, fine. So I go there, sitting at her office. She squeezes me in. She's like, Julie, your blood pressure is obscene. The fact that you had a headache for like 72 hours is obscene. We're looking at hypertension here. We're looking at preeclampsia. I'm really concerned. I'm going to call your OB. My suggestion is you go right to the hospital, but let me see what your OB says. And one of my very good friends at the time also was an OB at the practice. I tend to make friends that are professionals. It's very convenient. And so we're talking and I come in and she's like, oh, it's good to see you. And I'm like, yeah, Emily, I had a terrible time this weekend. Something's not right. I feel like it's not right. I need to have this baby. And she's like, all right, let me see what I can do. And she talks to like the head of the practice and she comes back to me and she goes, congratulations, I just got orders. You can have the baby on Wednesday. We'll induce you then. This is Monday. And I'm like,
Wow.
I sort of don't feel like you all are hearing my urgency. So I tell my husband, who had like just parked the car and came in, and he's like, all right, are we going to the hospital? I'm like, we are not. We are delivering the baby Wednesday. He goes, like hell, we're delivering the baby Wednesday. Your MFM told you needed this baby out of you now. And I'm like, well, that's what I heard too. He's like, I don't understand. The MFM told us we had to have the baby now. My wife has had this headache that wouldn't go away until 2 doses of Percocet. That's not normal. She is really swollen. Her blood pressure is really high. Help me understand why we can't have the baby. And I call back the MFM and I'm like, I heard you on the phone. Here's what's happening. They won't let me deliver till Wednesday. And my MFM is now going ballistic. She's like, no, you need to get that baby out of you now. Like Wednesday is not good enough. So I go in and I'm being kept there overnight for observation, which I feel better about because at least if something happens overnight, I can deliver. I'm 38 weeks and 3 days and I have hypertension and I might have preeclampsia and this baby needs to come out. And even though he might be in the NICU, I'll take that risk because my health is at risk right now. And according to the ACOG guidelines, it is perfectly okay to deliver someone with the conditions I have. Oh, and by the way, my kid is IUGR, which is another part of ACOG guidelines, in which is okay to deliver before 39 weeks. So we are going to deliver me tomorrow because we are sticking with what guidelines suggest.
You know what this brings up, though, a lot is for people that aren't aware or don't realize they can advocate for themselves.
Which is the majority of women, right? Or the majority of people who are pregnant don't know that they can do that. So I'm so lucky I know all this information because this is the work that I do. And so the next day I was able to get induced. It was a 3-hour labor. He like popped on out and was able to have the birth that I was hoping for. Not that that was the end goal or anything, but like that, it put a nice bookend. So after a very lengthy story, that is my story where I have 3 living children and I have 3 children that I hold in my heart. And I am a advocate. I've testified in front of various state legislatures. I've written to Congress. I've been featured as part of an amicus brief to the Supreme Court. Not that that did any good recently, but this is my passion. And this is why it is my passion, because it is the way I honor the 2 babies that I never got to raise.
Yeah, I don't even
to add to that. I mean, that is such an ending.
I know. I don't have anything to say. I think we should just end it with that because this is Julie's story.
Yeah.
We appreciate you sharing it both with us and all those other people that you're helping by telling your story like this.
Thank you so much. And thanks to everyone for bearing in with a pretty long snack. I feel like this is more like a midday meal.
It's like a buffet on a cruise ship where you can just sample and you can eat as long as you want to.
That's right.
But every course is important. You can come,
you can walk away and come back if you want to. Yes. It's okay.
Thank you so much for all your time and your knowledge.
Thank you for having me. Truly, it's an honor.
Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review The Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.